Cervical spondylosis is a degenerative condition in the neck. It involves the formation of bone spurs, and it happens to everyone, and it happens slowly over time. Some people have a lot of bone spurs, some people only have a few bone spurs, but the bone spurs can cause pressure on the spinal cord, then the nerves, and that can result in pain and neurological problems, including weakness, numbness, and even difficulties walking. This is a model of the spine. The discs are here, the vertebrae are here, and the nerves come out of the spine in the edge. In cervical spondylosis, bone spurs form at the back of the disc space and press on the nerves in the spinal cord. Sometimes there's arthritis in these joints in the back of the spine, which also cause pressure on the nerves in the spinal cord. There are a variety of symptoms that cervical spondylosis can cause. If there is pressure on a nerve, it can cause pain, weakness, and numbness in the arm. If there's pressure on the spinal cord, it can cause numbness and weakness in the hands, problems walking, and even problems with your bladder and bowel. There are several tests that we use to diagnose cervical spondylosis. Of course, the most important is actually examining the patient, because the patient's exam can tell you whether the problem is from the cervical spine or from somewhere else, such as the shoulder. The most useful diagnostic test is an MRI, and sometimes we use other tests, such as a nerve test called an EMG and nerve conduction study, and sometimes even something called a myelogram. If the symptoms are mild, non-surgical treatment is always the preferred treatment, and this could include epidural steroid injections into the spine, physical therapy, traction, massage, and anti-inflammatory agents such as Aleve or ibuprofen. If it becomes more severe, then we do consider surgery, and surgery is a very reasonable and effective option to treat cervical spondylosis when the symptoms haven't gotten better, or if the patient has significant neurological problems such as weakness or numbness. The surgical treatment for cervical spondylosis is determined by the severity of your condition. If the patient has just arm pain in one arm, then it can be treated very simply with something called a posterior cervical foraminotomy, which is a minimally invasive procedure. If both arms are involved, or if there is significant neck pain, it needs to be treated through the front of the neck through a procedure called an anterior cervical discectomy with either a fusion or a disc replacement. If there's spinal cord compression, the procedures are either an anterior cervical discectomy with a fusion or going through the back of the neck and performing either a cervical fusion or a cervical laminoplasty. In cervical spine surgery, the risks can be quite minimal, but can leave people with a little weakness, a little numbness, or even permanent pain. There are other difficulties when a patient has a fusion, including poor healing of the fusion and difficulties with the hardware, as well as difficulties with the levels above and below. However, even in that situation, the risks are very small compared to the benefits and the good outcomes that patients have from having a cervical spine procedure. I do not promise patients that they will be pain-free or that all of their neurologic deficits will disappear. However, things will be a lot better and their quality of life will be much improved with surgery. The risks, although small, are always there, and it can include things like a little weakness, a little numbness, occasional pain. When we deal with other more complex spine surgeries, there are more risks, including possible fusions that don't heal or difficulties with the levels above and below. There's no reason to be scared of spinal surgery. In this day and age, with all of our equipment and modern operative techniques, cervical spine surgery and all other spinal surgeries are very safe. The benefits greatly outweigh the risks, otherwise we wouldn't offer it as an option to anybody. The risks are always present in any surgery, but because the techniques are very safe, the risks are quite small, and the chances of a very good outcome are very high and on the order of 90 to 95%.